Hi, this is Madelaine Golec, Pelvic Health Physiotherapist here at Eco Physiotherapy. Welcome back to the 5th video of our pregnancy series. Today's video is strictly a demonstration of sitting postures for during and after pregnancy, and these can be especially helpful if you're experiencing any lower back pain or pelvic girdle pain or pain around the hips. So what I want to start off with today is showing you the position you should try to avoid, especially ladies in your 3rd trimester. This position you want to try as best as possible to not sit in. So the first position is the cross-legged position. One knee over the other knee. Now I don't know about you, but sometimes I like to also even wrap my leg around my leg a second time. This is even more difficult, especially at 35 weeks. This is not a good position because what it does is it kind of compresses the pelvis and can lead to discomfort. But not only that, usually in the 3rd trimester, the baby's head is turning down in toward the pelvis, and that posture actually takes space away from the baby. And we certainly do not want to motivate the baby to change position. We want the baby face down. So, best to just avoid that position. So instead, you can try some of these positions. If you like to cross your legs, what you can do is you can actually cross at the ankles. So for example, crossing with your feet underneath the chair, perfectly fine. Keeps the pelvis open and you can have the legs crossed. Alternatively, you could sit with your legs straight and crossed at the ankles. You just want to make sure that your knees are sort of pointing outwards. So again, kind of keeping the space in the pelvis open. If that position becomes uncomfortable, you can try the sit-up straight position. So that is basically where you come to the edge of the chair, your legs are open, and instead of sort of sitting in a slumped posture, you want to make sure that your chest is up and your shoulders are down. So you're kind of almost trying to pull your shoulders down toward the chair, and you're sitting sort of straight up. If that position becomes tiring or becomes uncomfortable, you could do the sit back with some back support. So you could try using one of these discs. Basically, it allows you to reposition your pelvis and provides your tailbone and your lower back a little bit of cushion. You don't have to. So I'm going to turn sideways. So I do have the cushion, and I'm just going to place it backwards. I'm going to put my back all the way to the back of the chair, and I'm going to allow it to be supported with my legs open. So just showing you from the front, basically in this type of position where there's lots of space for the baby. Lastly, you can try out this position where you put your ankle over your knee. So you're not crossing your leg, you're kind of opening up the pelvis on one side. You may find this position gets uncomfortable after a bit, but you can then alternatively switch legs. So hopefully you found this video helpful. Test out the postures, and we look forward to seeing you on our next video. Thank you.